Let's talk about the pathology of ankylosing spondylitis. Now, in order to understand the pathology of ankylosing spondylitis, first we have to understand what enthesitis is, or what is an enthesis is. To start off, an enthesitis is the characteristic lesion of ankylosing spondylitis. By characteristic lesion, we mean that it is only found in ankylosing spondylitis or in the family of the diseases in which it is a part of, known as the spondyloarthritis. Enthesitis is also defined as the inflammation of the fibrocartilaginous enthesis, which is found at the junction of either tendon, ligament, the capsule of the synovial joint, or all three of these structures. Now, enthesis and the resulting enthesitis can be found both at the axial joint and at the peripheral areas, that is, the peripheral joints. Now, in order to understand both the enthesis and the enthesitis, we have to take the help of a diagram. Now, this is a diagram of a synovial joint with its distal end and its proximal end. Now here you can easily see this is the extensor muscle with its long tendon. This is the synovial cavity, the accompanying bursa, and this is the connective tissue capsule which covers the synovial cavity. Now on the opposite side, we have both the flexor muscle, the long flexor tendon, the epiphyseal bone, and the articular cartilage. Now we can also see that there is also a ligament which covers the anterior side of this capsular area of the synovial joint. Now entheses are the point where either a tendon, ligament, or the capsule of the synovial joint connects with the bone. So its inflammation or the inflammation of the surrounding connective tissue is termed as enthesitis. So the enthesis at this point where only the tendon joins with the bone, or the enthesis at this area where only the ligament and the capsule joins with the bone, or at the area where both the capsule, the ligament, and the tendon join together at the bone. Inflammation of either of these sites will result in a condition known as enthesitis. And enthesitis is a characteristic lesion of ankylosing spondylitis. Next, we're going to study about sacroiliitis. Now, sacroiliitis is a typical and most common condition associated with ankylosing spondylitis. It is found in about 100% of all patients presenting with this complaint. So in order to understand this particular lesion or inflammation is vital to the understanding of the condition. Now, a sacroiliitis is the inflammation of the sacroiliac joint. Now, with the sacroiliac joint, we mean that the synovial joint that is formed between the sacrum of the vertebral column and the ilium part of the hip bone. Now, this synovial joint, when inflamed, is termed as sacroiliitis. And this again is found in about 100% of all patients presenting with the complaints of ankylosing spondylitis. So understanding this condition or this joint inflammation is vital. Next, we're going to study how the sacroiliitis takes place. Now, what happens is that in sacroiliitis, there is both synovitis, that is the inflammation of the synovial cavity, and a myxoid marrow. With the myxoid marrow, we mean that there is introduction of some mucoid elements inside the marrow that is present inside the bone. Now, both of these can result in pannus. Now, pannus is the encroachment of vascular connective tissue over other tissues. So, both of these synovitis and myxoid marrow results in pannus and subchondral granulation tissue, which is a hallmark of an inflammation of bone. Now, this results into marrow edema. Now, marrow edema here means that edema that surrounds the bone marrow, not the edema which is found inside the bone marrow. Now, marrow edema along with enthesitis with chondroid differentiation will result in the infiltration of T cells, macrophages, plasma cells, and osteoclasts. Now, when all these three events start to take place, what happens is that we get erosion of the joint. Now, with erosion, we mean that there is obliteration of both the cartilage, which covers the synovial joint, and sometimes even the bone. So, obliteration of these tissues inside the synovial cavity results in the erosion of the said joint. Now, whenever a joint is eroded, what happens is that there is an attempt for its regeneration. Now, for synovial joints, whenever it is destroyed or obliterated, what happens is that its regeneration results in introduction of both fibrous and cartilaginous elements or tissue between the two bones instead of the characteristic cartilage and the synovial cavity. Now, this regeneration then, after some mineralization, results in the formation of bone between the two already bones which form the joint. This results in the ossification of the joint. And ossification of the joint, along with the fusion of the bones which take part in the said joint, is again hallmark of an ankylosing spondylitis. Next, we have the vertebral column. Now, vertebral column and its fusion again is found in about 100% of all patients presenting with the symptoms of ankylosing spondylitis. But it might vary patient to patient as to its frequency, the site, and the amount of the vertebra that take place in the fusion and the ossification. Now, we know all of this either through the spine autopsy and biopsy studies, that we have studies both the vertebral column of patients who have passed away and also through the biopsy studies. Now, whenever we have done these studies, we have always found that there is some kind of inflammatory granulation tissue at the site. And granulation tissue at the inflammatory site is usually a sign of increased inflammation. Now, this results in the junction of the annulus fibrosus. Now, you might recall from your knowledge of anatomy that vertebral column is composed of various vertebra, and all of these vertebra have a posterior vertebral body and an anterior vertebral body and a posterior spinous process. Now, this vertebral body is joined together via cartilaginous disc. Now, this cartilaginous disc is further composed of a nucleus pulposus, which is found in the middle of that disc, and the annulus fibrosus, which is found at the periphery of the vertebral disc. So, what happens is that the outer annulus fibrosis starts to join the bodies of the vertebra, and this results in a bony protuberance. Now, it must be noted that not only bony protuberances are formed at specific sites, but sometimes the whole of the annulus fibrosis, that is, the whole of the vertebral disc, starts to destroy, starts to disappear, and results in the fusion of the bodies of the vertebra. So, as you can see, this replacement by bone or ossification then results in the formation of a structure which is known as a syndesmophyte. A syndesmophyte is a structure where the bodies of the vertebra are joined together, are fused together through ossification. Now, this presence of this syndesmophyte is again pathognomic or an important feature of ankylosing spondylitis and is frequently seen on x-rays of the patient suffering from this condition. Now, syndesmophyte once formed will result in a spread of the pannus. What happens is once two vertebral bodies have fused together via the ossification, this results in the encroachment of vascular fiber tissue over the other vertebra and the vertebral bodies, resulting into the recruitment of the vertebral bodies of other vertebra to the syndesmophyte. So, if two vertebra have joined together via ossification to form a syndesmophyte, through pannus, more and more vertebra will start to form, will start to take place into the syndesmophyte, and it will increase usually towards the cranial side. So all of this will result in ossification of the whole of the vertebral column. Now, this ossification of the whole of the vertebral column will result in ossification of all of the vertebral bodies, resulting in one single bone from the cranium to the caudal area. Now, this results in lack of the complete motion, the lack of the range of motion, and this results in more prone to the fracture, sometimes even injury to the nerves. So, whenever such ossification takes place, such patients not only lose their ability to move and their whole range of movement, but they are also more prone to the fracture and the damage to the spinal nerves. Next, the pathology of the vertebral column. Now, if we want to understand this, before we were talking about how it happens and how it spreads. Now, this is the diagrammatic representation of that same process. Now, this is a normal spinal cord. Now, it's normal spinal vertebral column composed of the cervical, thoracic, lumbar, and sacral vertebra, and it has a very specific S shape. Now, this S shape is vital for the movement of the person and the range of the motion that he or she shows. Now, what happens is that in a normal spine, this is a normal vertebra. This is the vertebral body. This is the spinal process, and this is the apophysis. And this apophysis sometimes results in the ossification of the apophyseal joints that we will study further down. So, in a vertebral column, between two vertebra, there are two kinds of joints. One, there is a joint between the bodies of the vertebra. Other, there is a joint between the apophyses of the vertebra, also known as the facet joints. So, what happens is that there is inflammation of the vertebral disc which is found between the bodies of the vertebra. Now, this inflammation of both the vertebral disc and the ligaments that hold this vertebral body, along with the inflammation of these joints, these apophyseal joints or facet joints, will result in the formation of a syndesmophyte. Now, syndesmophyte, as I said earlier, is a structure formed by the fusion of two vertebra via ossification. So, this is what is happening here, that there is ossification after the inflammation of the vertebral disc, resulting in the fusion of these two vertebral bodies, and this fusion is of ossified nature, and this also results in bony protuberances. Now, it must be noted that this is usually what happens at the earlier stages. That at the earlier stages, only certain points of the annulus fibrosis show inflammation and the ossification that results in the joining of the vertebral body. What usually happens is that there is a complete fusion of the vertebral body, complete disappearance or obliteration of the vertebral disc, resulting in the fusion of the vertebral body. Now, through pannus, it can result into the fusion of this vertebra, then again through pannus, which encroaches usually towards the cranium, can also result in the recruitment of this vertebra, resulting in extension of this syndesmophyte. Now, next we have to learn about the apophyseal lesions. Now, as I said earlier, that the apophyseal lesions are the inflammation of the apophyseal or the facet joints. Like I said, the two vertebrae are joined together either via the vertebral body or through the apophysis. Now, these apophyseal joints sometimes show inflammation along with the inflammation of the vertebral disc. Now, this results in lesions which are separate from the main lesions, resulting in vertebral inflammation, the whole vertebral inflammation, not just the vertebral body, which then again results in osteoporosis. This osteoporosis combined with the loss of vertebral bodies at the disc margin will result in a process which is known as the scarring or barreling. Now, scarring or barreling is a phenomena where there is a loss of the corners of the vertebral body. So it loses its round shape and turns into this scared or barreled structure, which then joins together to form this desmophyte. Now, if we have the synovitis along with this scarring and the barreling at the apophyseal lesion, what we get is a subchondral bone marrow granulation tissue. Now, bone marrow granulation tissue indicates that the inflammation is increased or increasing at an accelerated rate. Now, this results in the pannus, that is the encroachment of the vascular connective tissue, resulting in the syndesmophyte along with the fusion of the facet or the epiphyseal joint. So syndesmophyte not only contains the fusion of the vertebral body but also contains the fusion of the epiphyseal joints too. Now this must be noted because the inflammation starts from the vertebral body, spreads towards the spinous process, also starts to infect also starts to affect the epiphyseal lesions, and this results into the ossification of the epiphyseal joints, resulting in formation of a complete syndesmophyte.